My name's Victoria and I live in the Barossa Valley. I moved here to Adelaide last year for work. I have 4 children and I work in the aerospace industry. My hobbies are roller skating and rock climbing, hiking, that kind of thing, so I live quite an active life.
I'm Tim Hughes. I'm a hematologist working in Adelaide at the SAMRI, which is the South Australian Health and Medical Research Institute, very closely aligned with the Royal Adelaide Hospital. And I've been looking after patients with chronic myeloid leukemia for 35 years.
Before my diagnosis, I was very busy. I was actually working 2 jobs and I actually hadn't even gotten to organise a GP in Adelaide. And I was very preoccupied with my new job and I didn't have a lot of spare time. So before diagnosis, I was flat out, really. I think some weeks I was working 50 hours a week. I just organised a checkup, just a regular annual checkup, and that's when I discovered that my blood results weren't quite right. And so I got called in to discuss that, and then I got referred to see Dr. Hughes. And it was a bit scary and I didn't really know who to talk to. So when I first visited Dr. Hughes' office, I had a lot of questions about different treatments and options, and I was a little bit confused about my particular level because I knew that there were different stages. Dr. Hughes was really good in explaining the stages and I was in very early stages, which actually really put my mind at ease.
Victoria expressed very clearly the typical response of a patient with chronic myeloid leukemia when they're first diagnosed. It's come out of the blue in most cases, and they've heard the word leukemia. They know the implications of that. So it's important for me as the first job when I see a patient with chronic phase chronic myeloid leukemia is to reassure this is a condition we can treat. You can live to a healthy old age with this disease.
When I first got diagnosed, I did what most people do with anything, and I went to Google and started looking at things. So I'd done some research on the internet, but it was pretty stressful because it is such a huge spectrum and figuring out where you fit in that spectrum. But Dr. Hughes was really good at explaining everything.
When I talk to my peers about management of CML, I always emphasise that decisions, if at all possible, should be shared decisions. About what's the best approach. That's the best way to motivate a patient. Things you need to listen to. The patient will want a long life and a high quality life. And so you've got to select the drug that's going to fit with that sort of agenda. She has 4 kids, so she wants a long life, but she's also got a very demanding career. So she wants a healthy life where she can cope with her work and with all of her activities that she wants to continue.
A typical week for me is not really unlike any other week before I was diagnosed, to be honest. I just wake up, I take my tablets straight away, and I just get on with my day. My appointment just before Christmas, my results were all they were looking really good. So that was nice to go on holidays knowing that was all running smoothly.
You need this therapy to control your disease, and if we do well, 5 years, maybe a little bit short, a bit longer, we might be in a position to stop altogether.
And I feel really, really blessed that I have gotten to this point where it is just like taking a tablet every day and I can just continue life.